Hi doctors. Yes, this is a special module for you. Very, very special module because many of you make mistakes in the exam. So just to avoid that, art of solving MCQ and how to approach a question, shift, how to save time. And so you are making so many questions wrong in the exam. So what will happen? All the journey you came, all the effort, it will become pointless. So at this moment, please watch this module so that definitely after watching this you are going to improve at least one or two question. But if you follow this properly, you can improve 10 to 15 question. That means you can save 5 into 10, 50 mark to 75 mark, and that will give you a great huge difference in your rank. Okay, so please watch this module. If you want, you can watch in little fast, 1.2x or 1.5x also, no problem, but please watch. Okay. Okay, now I am going to see approach to solve MCQ. So here I told marking wrong options, art of solving MCQ. So art of solving MCQ, how to approach question shifts, how to approach questions shifts, save time, and if you follow this, do this to get 10 to 20 extra correct. Okay, this is very important. Why? We'll see. Okay, so how to approach to solve this MCQ. So we will see in this session, this 15 to 20 minutes, definitely it will have some impact on your exam. So we know today is 21st August. Okay, 9 days are there for the exam, just 9 days, and still counting, eight and a half, eight, like that it's counting. So at least you should know this now. Okay, because everybody is preparing, everybody is solving question, everybody is making mistakes. I'm telling you, everybody is making mistake. Not you, not the person with less rank, those with good rank, even top rank also, they will make mistake. Making mistake is normal. That is actually normal process, a natural process. Nobody can escape from that. How much you reduce those mistakes, how much you improve from the mistake, that will reflect in your rank. Okay, finally. So we will see the approach to solve MCQ. We know NEET PG exam is a 180 question exam. 180 questions are there. Okay, now it was 200 before, now it reduced to 180. So you feel like, oh, exam pattern change, there are difficulty. It was 300 question exam 300 minutes before, it was very tough. Then they reduced to 200 question exam, 210 minutes something, 210 minutes. Okay, so they changed it. Now I think it's 180 question and just 180 minutes, just thinking like 180 minutes, 3 hours. Okay, so we have 180 question, 180 minute. Okay, so each question have approximately 1 minute. I told approximately 1 minute. Why? I didn't tell exact 1 minute because we are not solving some question in 1 minute. We are just solving some question in seconds, 15 seconds, 10 seconds. So that also we'll discuss. Okay, this is very important. So 180 minute, 3 hour. So maybe if it is 200 minute, okay, this exam session. For example, if it is 40 minutes ka 5 session, so it is 200. Okay, so we have, but I will tell you, like, think it like 180, 1 minute for each question. Don't see the extra time, extra minutes. So we had 10 minutes extra whenever we are writing 200 question. Whenever we are writing 200 question, we have 210 minutes was there, 210 minutes. That is 3.5 hours. Okay, 3.5 hours was there. So don't worry about the 10 minutes. Okay, that 10 minutes is actually waste. Not the waste, it's not matter, because somehow you will lose that time. So whenever you think you have 1 minute, you have less time, you will work more, so you will go fast. Okay, and that is why here one more thing is, it is having different sections also. So just this is a brief. Yeah, this is a brief. Now we will go see individual part. Okay, so what I am going to say is we have 180 question, right? We have 180 question. In that we have something called direct questions and moderate questions, lengthy question, and very tough questions. So I'll explain this. Okay, so imagine your GT score is 85, 80 to 90 out of 180. Okay, 80 to 80 to 90, 180. You are an average student, or you have 110, 120, 130. How much you are getting in GT, let it be. So what I have to say is, in this 180 question of NEET exam, there are around half, 90 questions will be direct. You can see 50% will be direct questions. Direct question means, so we are going to solve that also in the next coming module. Direct question mean question option, the answer will be there. You can see the option, you can mark it, whether it is correct or wrong, your score will improve. That's all. So 90 question, almost 50% will be direct question. Okay, in this direct question, 30 to 40 question will be very easy, very easy. 30 to 40 question will be very easy. Anybody can answer, anybody can answer. Like those at least who know some idea, they can answer. Next 40 to 50 question is like, if you studied subjects, some subjects, okay, for example, they'll directly ask some diseases, okay, and the management. So it will be there. If you know, you can answer directly. So 40 to 50 question will be like this. So 30 to 40 will be very easy, very easy. And 40 to 50 will be, you should know the subject, you will answer. So this is very important, but 90 question. Okay. Then there will be some moderate questions. Okay, so moderate questions will be there, and very lengthy question and very tough question. So you see, tough questions are around 10. So out of 180, tough questions are around 10. Okay, only 10 questions are tough question. That is like very difficult to answer, very difficult to answer. So getting correct in this tough question will be very tough. And those who are studied multiple and getting a top rank, the top rank is decided by here also. Those who are getting top rank, this 10 question will decide. 10 to 20 question, 10 question, usually it is average 10 to 15. Okay, and there are some moderate questions. 50 question will be moderate tough, moderately okay, moderate questions. And some 30 lengthy, 20 to 30 lengthy question will be there. 20 to 30 lengthy questions will be there. So this is the usual pattern of the NEET PG. Okay, this is the usual pattern of the NEET PG. Okay, so very important. Very important. So imagine you are standing somewhere 90 to 90 out of 180. Okay, 90 out of 180 in this GT. That means you are able to get 105 to 110 correct in NEET exam out of 180. That is sure. That is sure. This is sure. Okay. So if you are getting 70 GT question, you may get around 85 to 95 in NEET. That is sure. That is the probable guess or the probable thing. And every time this is true only. Why? Because I had some questions correct. Okay, I got around 140 correct out of 200 in main NEET exam. So I got only around 110 GT correct. I had done less GTs. I got 100 GT correct. From this 100 110 GT, I went to around 140. Okay, that is different. So this is you have to keep it in mind in this exam. So if you are getting 70, you will score good there. Okay, don't, so it won't be lesser than that. It will be always more. So 99.9% you will be scoring 10 to 15 question minimum better than your GT. That is sure. So here I told something. Okay, here I told approach to solve MCQ. We are starting the discussion. So this is very important session. So now, I told we have 5 sections. Okay, 5 section with 35 into 36, and all these 36 are like not subject wise in order, anatomy, physiology, but no, it is mixed question. And in the question also they are connected with different subject. So this is a mixed question, mixed subjects. Okay, these five sections will be there. Okay, 5 sections will be there. So what is the mentality of student? So we have 4 students sitting here. Okay, so that is very important. Why? 4 students are getting 4 sections starting according to the question pattern, according to the system. So they are getting different question. So he is getting a question starting with medicine. He is getting starting with derma. He is starting with patho. They are starting with pedia. The pattern will be completely different, but all the questions are same. So imagine you are an average student, or you are a student who studied well, but you are not confident in a subject like ophthalmology. For example, you are not confident in ophthalmology. So you are not confident in ophthalm, or you didn't study ophthalm. But unfortunately, the first session you got question from ophthalm, and what will be your mentality? Oh my God, gone. My exam is good. That is completely wrong. Don't think like that, because you may not study ophthalm, but the first question will be from that. Don't get panic. Okay, why? From ophthalm they will ask only 6 to 8 question. Will come from that subject, and you can make 3 to 4 correct even without studying. Even you study little, you can make half correct. Even you didn't study, you can make 2 to 3 correct, that is sure. So you can make around 3 to 4 correct even without study. If 8 question come, you can make 3 to 4 correct. It is possible. So you have to think like that. You, even though you are not studying, you can make exams the question correct. Okay, the exam question correct, that is important thing. And see, this is a big C. 180 questions are there. Only 6 to 8 questions from come this area. Only this from this oftal. Only 6 to 8 questions will come. That is why the other 172 questions are there. Okay, so just you are focusing oftal. Oh my God, oftal only came. It's gone. If you feel you are done, don't feel like that. So what you have to do, approach, I will discuss that, like how to clear. If you don't know how to skip everything, I will explain in the coming slide. This is very important. Okay, so see, he got medicine here, so maybe he know medicine, he will start. Definitely he should start. He don't know derma, so what he have to do, he have to skip that question and go, or he has to guess. That I will discuss how to do guessing, how to do skip, what to do. That is very important, very very important. Okay, and the other person got pedia, other person got some pathology. So the session will be starting according to your question arrangement, the 36 shift, how the shift arrangement, that is very important. Okay, very important. So yeah, this is something important. Yeah, everybody know 180 question shift based questions are there. 3 hours, 180 minute total. So 1 minute per question, so 3 minute, one question 1 minute. Let it be like that only. That is the truth. That is the truth. Okay, so we have preclinical subject, clinical subject, paraclinical, everything will be there. How to approach NEET PG session, this is like you have to start before. So this is just you are attending the exam here. Okay, you are attending and seeing systematically, you are preparing. You have 8 days are there, 8 days plus is there. So this 8 days just to do the PYQ, just to do the revision multiple times fast, you can score well. So now we are coming to the core of the discussion. The core of the discussion, see, you will get a question like this. You see, oh my God, big question, leave. See the line, see the size of the question. This is a huge big question. If reading only will take more than 1 minute, then you are like, oh my God, what to do? Then what, you will start reading, you will reach the half, you will miss. Okay, leave, I don't know this topic, go. So how to approach this kind of question, and how to approach all the NEET PG question, you just see from now. So you start reading, then left. So you are losing your time here. The main thing is time. Here the thing is not your knowledge. Here it is not your knowledge. Okay, here it is the time is the matter. Time is the main thing. Time is the main thing. Because I will tell, because you started reading this question, in the halfway you left, then you come back to this question again, and you are reading this question. So what happened finally, you are losing 1 2 3 minutes. And because of, like, these kind of questions are coming, like five long question came, you are reading 5 long question, you lost some 6 minutes. Because of 6 minutes, you are unable to see the 6 question in the last. That means you are unable to do the 6 question. Maybe in that 3 to 4 direct question will be there. You are losing 3 to 4 question by losing time. So here the matter is not knowledge, it is time management. That is very important. So that is why you should know how to read a question. You should know how to read a question. That is very important. So you should know how to read a question. I will tell how to read this question. Okay, that is very important. So how to read a question? How to read a question? So how to read a question? You have to see something in a different way. Okay, different way. So this is a big question I gave to you. A big question. So you just see the options, understand the subject. Once start, read full, follow these policies, follow this concept, see options. So understand the subject. Once start, read it full. Now we'll go and see what is there. See, the big question come, don't start reading, just to see. Whenever any question is there, whenever a single question, new question appears, just to see the option. See option: hypokalemia, hyperkalemia, hypercalcemia, hyponatremia. Yeah, this is something related to medicine. Maybe medicine, or something related to medicine related, integrated. Okay, integrated some subject. Yeah. So you understood the subject. Okay, now if you want to read the subject, don't read half. You start reading completely and understand what. Why? Because if you read half, if you read till here, then you are coming back and seeing the question. You have to read it full. That means how much time? 20 to 30 seconds you used here, that time you have to put again. Then you will feel like, oh my god, I saw the question, I don't know. So once you started reading, what you have to do, you have to read completely from here to here, and you should understand, you should see important point, one point. So if you don't know anything about hypokalemia, hyperkalemia, you are feeling, oh, this is medicine subject, so here you put some 5 seconds, okay, invested 5 seconds to 7 seconds, you are like, okay, this is medicine, I will come to medicine last. Then you don't read anything here, then you don't read anything here, don't read anything. You go to the next, skip to the next question. Next question. Why? Because you are not reading the question half, you are not touching the question, you are just seeing and understanding this is medicine. Then last you are coming back to this question, you are understand, oh, this is the medicine question I left, now I have time, I will see. This should be your mentality. Okay, okay, that is why. So how to read a question, see the options and understand the subject. If you know that subject, if you know that part, the specific topic, you go read completely. If you don't know, you will come back later, completely skip that reading part, because you want to save time. Time is important. So once you start, read it full. That is very important. So if you don't know, I don't know, leave it. I don't know, why you are stressing on that, I don't know anything in that option, leave it. Okay, leave it. So, and don't quit, you are not going to quit that. Okay, okay. So one more important thing I have to say is how you are losing your good rank, how you are losing your good rank. So I told we have 180 question in the exam. Okay, so we have 80 to 90% simple question, 80 to 90 will be simple question, 80 to 90 question will be simple question, very simple question, direct question. And difficult question will be some 30 to 40, moderate question will be some 60 to 7, and very tough question will be 10 question, very tough will be 10 questions will be there. So very tough will be around 10. Okay, so all are worried about this tough question. Oh my god, what it comes, I don't know this. So everyone thinks this tough question will decide. No, never. All are worried about the tough question, but actually rank is decided by the small question, the small simple question, direct question, or the simple question. I will tell you. So imagine 80 to 90 question came simple, you made unnecessarily 5 to 6 question wrong here. You made unnecessarily, by your mistake, by your enthusiasm, by your over energy, overconfident, you made 5 to 6 question wrong. Okay, and you couldn't make it well here. So imagine you made 5 6 question wrong in the simple session. That means you are low behind, far behind, you reached little behind. Why? Because other people will make this correct. The probability of making correct is easier here, you are making here wrong 5 to 6 question. That's why you are behind 10,000 members, 20,000 members. And imagine you want to overcome them. You got 5 to 6 question wrong, you came back, you want to overcome, you want to go front, you have to make 2 to 3 question correct in the tough question. That is literally impossible, or literally difficult, practically difficult. Yeah, it is not impossible, it is practically difficult. So you want to, you made a simple mistakes, you are going back. If you want to overcome, you are trying to make correct here, it doesn't work, because the probability of making correct in this difficult and moderate also high. So if you want to make it friend, you want to get in very tough question, that is practically difficult. That is why the simple questions, the 80 to 90% simple question will decide your rank. Okay, decide your rank. That is why don't worry about the 10 to 15 tough questions, just focus on your 90 to 100 easy question. Next, moderate some 40 to 50 question. In the 150 160, that will decide your rank. Okay, that is true only. And simple question, you have 150 average question and 30 tough. Okay, you made out of 150, made 140 correct, you made 5 correct here, 145 is a good one, right? Correct, no? So imagine what people will do. It is one, what people will do. So 120 to 130 will be easy question, in that they will make 20 to 30 wrong. Then after exam, oh, I made that mistake, oh, I made this pin, this, oh, this nerve injury. this will happen and they will regret. That is why you should see this importance of approach question, see the question, read the option. So we will discuss that also. Okay, so now you see here, it is not the number of correct alone determines. So number of correct, you told I got 130 correct, 145 correct, that doesn't mean you will get good rank. There is something called role of negative marking. Okay, so role of negative marking, this is also very crucial and important. Why? Because imagine you got one student, one average student, he got 110 correct, 65 wrong. He got 110 correct and 65 wrong. The other student attended 102 correct. So he is 8 question behind. Okay, 8 question behind. But he got 25 wrong. He got 25 wrong. He skipped so much. So ultimately, you see their marks. He got 375. He got 383. And you see 8 mark difference. So 8 mark difference is like a 2000 to 4000, 2k to 4k rank difference in that area. Sometimes it will go to 5k, 8k difference also. Sometimes it will be 500 to 1000, depends upon the area, the graph of distribution. That is very important. So what happened here? You can see, so the number of correct is not going to determine your rank. It is the mark and the art of skipping the question, art of avoiding negative, everything will matter. So we will see that. See, this is very important. So number of correct, more correct doesn't give more mark. Yeah, definitely more correct, more mark. So nothing difference here. Okay, there is some 8 question ka difference. So if imagine you got 110 correct 60, there will be similar mark, they'll get similar. So number of questions also important, getting correct, that is also important, along with the negative mark also important. So that is why we should know something called rule of guessing, because sometime out of 180 you may be knowing only 110, 120 to 130. Okay, rest 50 questions are there. Okay, in that 50 question you may be knowing something theory about 30. 10 question you know one option, and 10 question you don't know anything. So you know nothing, you know one option, you know two option. If you know three option, three options, the fourth option you can explore. So you will be getting mark from there. So if you know nothing, if you are guessing, the probability of getting wrong will be more. Correct. If you know the two option, you can eliminate the two option. If you guess, probability of getting correct will be more. So imagine there are some 10 questions like this. You guessed, you got 6 correct and 4 wrong. Instead of not attending, skipping, you are getting almost 20 mark high, 20 mark more here. That is why you have to attend the subject, you have to attend this is very important. Okay, if you know one option, still your option, your thinking, your mentality, you can go for approach. Imagine there are some 8 question, you know only one option, you went for, you got 3 correct, 5 wrong, still you have 7 mark ahead. That is also very important. So going for guessing is important. You should guess, but if you don't know nothing, if you are guessing, that is purely like, if you are going for purely learn, that is up to you. I will suggest, don't do this, if you know nothing, don't go, because 10 questions are there, so if you are getting 2 8 wrong also, it is 0. But sometimes I won't suggest this. If you are confident, you can go, because 10 questions are there, you don't know nothing, 3 correct, 7 wrong also, you are getting 5 mark. That is true, but I won't suggest this, because there will be very small 1 or 2 mark or 3 mark or sometimes negative marks. So if you know nothing, don't go. And if you want to go, still you can go. There are chance of getting 0 or sometimes you are getting 1 2 3 mark. That is important. But I will always suggest, if you know one option, two option, go for guessing. That I can tell. So that you can do, that you can practice, no problem. Okay, so this is very important area. Now I am going to see this one. So this is very important. Okay, so see the question. Now we will see this. Okay, which of the following not be measured to diagnose metabolic syndrome? So now we will see some examples and how you will make mistake, how we can rectify. This is very important session. So which one of the following will not be measured to diagnose metabolic syndrome? So you will get the question. This is a direct question. So if you know, if you don't know what these people will do, they will see, okay, metabolic syndrome. hip circumference, glucose pressure, HDL. Oh, LDL is having some problem. LDL is not there. So HDL, so they will mark option A. They will mark option A. Usually, similar question will come. This is an example. Okay, so they are like, oh, LDL is having problem to body, hip circumference is important, blood glucose pressure, HDL is good cholesterol, so metabolic syndrome. So those who are studied 50-50, so student average student, they will go for this. Sometimes those who studied well also, they directly go and mark this. Okay, that is the problem. So, but you got wrong here, completely wrong, and they trapped you. They trapped you in the option A. Option A will be always a trap. You will just go punch and go, and you will get, okay, it is correct and easy. But once rank comes, mark comes, your mark will be, score will be low. Why? Because this is very important. So very important. Whenever you see a question, don't jump and mark. You should think, and you should know. Okay, if you don't know, just at least see the options. Okay, so why I kept this example, I kept a few more example to see. See here, correct option is hip circumference. Why? Because in the metabolic syndrome, the criteria is defined by the central obesity, hypertriglyceridemia, low HDL cholesterol, hypertension, fasting glucose. So BMI and LDL cholesterol are not included according to the diagnostic criteria by NCEP ATP3. That is very important. So that is why it is hip circumference. Actually that is not there. Okay, so that is waist circumference instead of hip circumference. And if it should have waist, if it should have LDL, we should have go for A option. So that is why they will trap here. See, a simple question, if you know metabolic syndrome, you will feel like simple, you will go, you will get negative mark. Clear? Now we will see more example. See, so you saw some image like this. Okay, some image they will give. Okay, maybe this time I will tell an image with some agitations. So you will think like, oh, it is plasma, yellow color. You didn't see the blood center. You didn't go to see blood bank, see the stored temperatures and all. Component preparation you didn't see. So they will give an image based question. Some agitation will be there. Some blood product will be there. So yellow color, you will think plasma sometime, and then you will think plasma minus degree Celsius. You will mark here. Or sometime what happen? Oh, the question it is like blood component. What is the story blood component? So blood component, you will think PRBC, and you will think, okay, it is around 2 to 4 degrees Celsius, 2 to 6 degrees Celsius. Actually, see, that is why it is very important. You should know that it is a trap. So these are platelets. Platelets are stored around room temperature, 20 to 24 degrees Celsius with agitations. So platelet they kept, it will be in agitation. So that question will come in your exam as image based also. Okay, they kept in 20 to 24 degrees Celsius. See, 30% will click on 2 to 4, 30% will be thinking it is plasma, and actually rest 35% make this correct. Still this 5% make 37 also. That is a problem. So this 35% people, actually this is a direct question. So why importance of this question? This question you can answer in around 20 to 30 seconds. Okay. Similarly, around 50 to 60 question will be there like this. So you are saving half of the time. 60 question you are making 30 minutes saved. 30 minutes saved. So for the lengthy question, you need around 2 minutes to read. You can invest the time there. So for each question, that is not 1 minute. It is average 1 minute. For some question, it is 20 seconds. Some question is 2 minutes. Not a problem. Finally, we should get it correct. That way only the examiner had prepared the question. So they are like in 200 minutes or 180 minutes, you are solving everything. It's not like 1 minute, one question. Okay, this is important. See, this is also a trap. Okay, now we'll see. Now something called go through the question. So if the question came, this is our question. So see the option: adenovirus, herpes simplex, HPV, CMV. Okay, this is something related to virology. So option we saw, then we are going to see a child present with trigeminal neuralgia. Okay, associated with painful vesicular lesion. Yeah, some vesicular lesions, vesicles. So yeah, herpes simplex maybe around the mouth. Yeah, HSV 1 and 2, mouth, anogenital, genital region. Yeah, it is mostly of herpes simplex. In inoculation of the cell culture, multinucleate giant cells. Oh, these giant cells. Yeah, inclusions, nothing but our herpes simplex. Okay, clear, simple. So you should go through the line. So here, what are the keywords here? What are the keywords I can say? The painful vesicular lesions, one, around the mouth, multinucleated giant cells. Okay, so this will give you answer to HSV, and is causing trigeminal neuralgia because inoculation of the virus into the nerves, it will cause pain. Clear? See, this is very important approach. Now we'll approach an integrator. See, HSV, multinucleated giant cell is there. See, the lesion is there. So this is very important. You should approach the question like that. Now we'll see one more question and we'll summarize. This is something called connected. So see here, they gave some image here. Okay, an 8-year-old girl presented with the follicular hyperkeratotic papules, some skin problem over the elbow, knees and buttocks. She has dry skin and lusterless hair, which are following the next step of evaluation. See, they got one disease. What is the next evaluation? Now you can see something here. It is looking like some toad skin. Toad skin. Nothing but our phrynoderma. Phrynoderma. In the deficiency of vitamin A. Vitamin A. So vitamin A is related to Wall's visual cycle, eyes, vision. So we have to go for the ocular examination. That is also very important. See how we connected. This is some skin problem because of vitamin deficiency. The vitamin cause problem in the eye. So our checking is ocular examination. So now we can rule out the vitamin D. Vitamin is D not related to any hyperkeratotic papules. Deep tendon reflex, any involvement, any vitamins. Vitamin B12, it is not related to any anemia related pictures, or it causes something called peripheral neuropathies and the issues with the spinal cord related nerve injuries and problems, numbness and all, but it is nothing mentioned there. So we can see, so vitamin A related to eye, ocular examination. See how they connected. Like this we have to connect whenever the option is there. So you can see vitamin D, vitamin B12, something related to vitamin and metabolism, the question, and you can see the dermatology image and this vitamin A deficiency linked to that one. So this is the important area how to see. Okay, so finally I have to say, you have to believe in yourself. Believe in yourself. This is very, very important quoting from me. This is not end of your life. This is a phase, and especially this phase is little tough, and majority will quit here. But believe in yourself. Don't quit. Be in this process. Still 8 days are there. Just complete this process. Just finish this process. After that you are free. Okay, just do from your heart. Don't think about the result. Whatever the results come, don't think about. Results matters on multiple factors. Your day, the day of your NEET exam. So if you are staying for your center is away, go previous day and eat properly, drink properly, sleep properly, be relaxed, attend. Okay, this is exam to not assess for knowledge, exam to assess your mentality. This is an exam for mentality, how to do time management, how to see the situation. You can score well even you didn't very well also. If you prepare average also, you can score for 100, 110, 120 also. That is possible. Okay, don't worry in that. But your approach will be difficult. So different, your approach should be different. So see how to approach this question. These are not simple questions, simple examples. We have different. Now you can see how I came to see the each line important option. You have to see how. Don't fall directly and click on their option. Take your time, think. So you don't want to get answer in 10 seconds. You can take 20 seconds, think it. Okay, see, don't get a trap in simple question like this. And moreover, guessing, how to do guessing, that is also very important. And how these rules are scientifically proven and fact. That's why I discussed here. And start reading, then don't left, continue reading. So this question is very important. Once you started, complete the question. If you didn't started, you don't know medicine, you don't know the topic, just completely leave. So just 5 to 7 seconds you analyze and going to the next. If you are like, okay, this is hyperkalemia, I know something, then you start reading, completely read it, invest your 1.5 minutes, come to the conclusion and mark it correct. That's all. Okay, so finally I wanted to say is very, very important thing is marking wrong option. If you reduce the marking wrong option, you will get better rank. And you are going to make wrong in the subject or the topics. The tough question are not going to decide your rank. The simple question are going to decide your rank. So that is why you have to think, do properly, clear the exam, come back, relax. Okay, so this is my special module for you. Thank you so much.